Good evening, everybody. Welcome to this webinar. My name is David Mwambari. I'm a lecturer at the African Leadership Center at King's College London and a co-faculty at the Oxford Consortium for Human Rights for the first about 5 years. On behalf of my colleagues at Oxford Consortium for Human Rights, I welcome you to all to our family. This is the second of four of our four webinars that are focused on COVID crisis. Our next webinar will be on migrant refugees and IDPs in the COVID crisis about early September. So please look out for announcement on that. But for today, we are joined by an excellent team of researchers and activists to discuss an important topic that is on so many people's minds, as it should be. But this is on people's minds that is really unusual. And the topic today we are focusing on is the inequality, racial justice, and COVID crisis. For this session, we have two parts to this webinar. One will be two presenters who are going to first speak on their topics. I'll introduce them in a minute. And then there will be that session be followed by a question and answer session, which then will be followed by two other speakers for the second part of this webinar. We will welcome question and answer, and we will give you more instructions, and as Alex has already given, just before the question and answer. As we start now, allow me to introduce Professor Sabina Alkire, Director of Oxford Poverty and Human Development, a research center within the Oxford Department of International Development, University of Oxford. Sabina will lead us this evening in a discussion on inequality as a global drive of transmission and development reversals, challenge and opportunity. Sabina will then be followed by Patrick, who I'll introduce before he speaks. Sabina, you now have the microphone.
Thank you so much, David, and thank you to all of you who are on this call. I'm really looking forward to the actions. The focus of this seminar is on inequality, and the key idea of inequality is that we want to look at reducing the distance between the top of the distribution and the bottom of the distribution. And if we are able to do that, then one of the ways of doing that is to raise the bottom of the distribution, which is to address poverty. And so what I'm going to do in just 10 minutes is try to share a little bit of some of the ways in which this could be done. And I'm going to do that by focusing on poverty, where we understand poverty to look at non-monetary deprivations, like having somebody who's undernourished in your household, or a child who tragically perished, or nobody with 6 years of schooling, or a child out of school, or not having clean water or sanitation or electricity or clean energy or good housing or assets. So we're going to be looking at people who are multidimensionally poor. And one of the observations that we have when we do that is that these people, if we improve their conditions, they will also reduce inequality. Amartya Sen observes that poor people's lives are battered and diminished in many different ways. And he speaks of overlapping inequalities that afflict the deprived and the poorest. So one thing that we do in our research group is we try to put very crude numbers on this by looking at 10 indicators for each person. So we want to know what's going wrong in their household, in their lives at the same time. And if people are in at least 1/3 of the dimensions, then we identify them as poor. And we do so using a global index that covers 101 countries and 5.7 billion people. We'll update this on the 16th of July to cover 107 countries with updated data for 1 billion people and trends for 5 billion. But what are the things that we find? I'm going to give you 5 things in 10 minutes. The first is that the lives of the poorest are incredibly complex. So I said we look at 10 indicators at the same time. And in all 10 indicators, if you are deprived in one of those indicators, you are usually deprived in more than one. 99% of the people deprived in electricity are deprived in something else. 81% of those deprived in nutrition are deprived in something else. On average, of the people who have any deprivation, they experience 5 or 6 deprivations at the same time. So when we think about overlapping inequalities, we have to realize that they really are overlapping. There are many things going wrong in the poor at the same time. So this is our baseline. This is pre-COVID, right? And then the pandemic strikes. And it affects different people differently. You and I are affected, right? We've been affected by lockdown. We've been affected by unemployment, by insecurity, by the fear of recession. But for many of us, it's a shocking exposure to a new threat. But for people who already have a number of deprivations in their lives at the same time, it's simply one more. So it affects them differently because there might be life-threatening conditions of other kinds that they already experience, plus the burdens of livelihoods. And so we want to understand these and redress them so that COVID doesn't worsen inequality and leave the minorities further behind. So when we use the global MPI, for example, we can look at a group of people who would be at risk of having a very bad outcome if they contracted COVID. And those would be people who live with nutrition, who don't have clean water, and who don't have clean energy. Because those who cook with wood or dung or charcoal or coal are at greater risk of acute respiratory infections, and COVID strikes the lungs. In what we do, we find 3.6 billion people have at least one of these conditions, and 472 million have all of them. And they are at high risk. And so just to give an idea of this, we map them, and the countries in the graphic that are darkest have the highest number of people in high risk. And the size of the dot is the prevalence of COVID, 24th of June. So that's just giving a bit of an overview. And then when we look inside countries, we see it's not just that things vary across countries, but both the level and the number of people vary across different regions, different age groups, different ethnic groups, or minority groups. So in this graph of sub-Saharan Africa, we see, and also the right panel with the bubble dots, you see that the blue is the national average of risk, and the red dots are the equivalents of different subnational regions. So you can just see in the map of Nigeria on the upper right side, the north is obviously the poorest, but it's also the highest risk. But we also see that in April, when the was entered into that particular map, COVID was more prevalent in the south. And so there's time to prepare, but there's an urgent necessity to prepare for any outbreak in the north. And it's not just by subnational areas. This is South Asia, 4 countries in South Asia, and rural areas usually have more risk than urban, but less of a difference between them than there is for poverty, which is interesting because COVID does focus in urban areas on overcrowding people who've lost informal employment and have no food stocks in their home. But then when you look at the caste groups in India, for example, the scheduled tribes are poorest and most at risk. We're releasing next week a briefing on ethnicity. So what I've done is just tried to paint a global picture using a few numbers, and there are lots and lots of details on our website, but just recognize that poor people already have difficult circumstances. COVID is just one more complication. And poverty, but also particular COVID deprivations overlap in different countries and in different subnational regions. So already we are dealing with huge inequality in poverty and in risk for COVID. But of course, that's at the global level. And someplace like Mexico is very different than Niger and from the Philippines. So what many countries do and are doing as part of their COVID response is using nationally tailored measures of poverty and of vulnerability to inform their emergency response. So for example, Pakistan, its MPI already has health education and living standards in it, but it added households that have an older person. It added overcrowding and hand washing, ownership of a mobile phone so that they could receive updates and benefits. Other studies that we've done have included domestic violence, or if people have chronic health conditions of one kind or another. And these kind of data sets are very useful because they're taking an existing national idea about what poverty might be and what the COVID triggers, and then they're trying to map that. So I'm going to give you one example, and it's from Colombia in South America. Within 2 weeks of the pandemic, Colombia built a map. Actually, it already had a map of poverty at the census level. But, you know, we have to protect people's privacy. And so usually we cannot access health records and poverty data. But because of the emergency, they were able to blend these. And they could do a map where they had health records, had cardiovascular conditions, diabetes, different health risks, and who was poor, and also look at access to healthcare systems. And so this kind of data was them to see the parts of Bogota, this is a map of Bogota, where the pandemic was really at risk for different people. And it was particular groups that varied by others as well as socioeconomic ones. So these kinds of discussions can leave us feel very disheartened. Already a great deal of poverty. It already wasn't maybe going down fast enough. And then we have COVID and we're at the start of a recession. And so we can feel quite gloomy and dejected. But the fifth lesson that I wanted to convey is that change is possible. David might bring in later a beautiful change and study that he's done from the bottom up of youth leaders in Kenya. I know stories, you know many stories of people who are doing what they can in their different situations. I wanted to cite in particular an article from the Financial Times from Amartya Sen. He observed that in Great Britain during World War II, there was a food availability decline. There was a food shortage. And so what the policy people in Britain did was they arranged rationing and social support. And the results were quite concrete. During the 1930s, life expectancy at birth in England and Wales went up by 1.2 years for men and 1.5 years for women. But during the decade of the war, because of more equal food distribution, so better nutrition, life expectancy for men went up by 6.5 years and for women by 7 years. And so he makes the point that with some kinds of policies that were not rocket science, there were fiscal crunches, there were lots of problems during the war, and yet with careful policies, one can turn the corner. And when those careful policies at the policy level are supported by bottom-up movements, activists, people who are volunteering, and the outpouring of compassion that we saw in many places as the pandemic has spread, and solidarity with those who are being left behind, then I think that together we will be able to turn a corner. But to do that, we have to understand the data, understand the magnitude of what we are up against in terms of the poverty that already exists and the inequalities that already exist pre-pandemic, but also take hope that with some huge changes that maybe wouldn't have been possible in an earlier period, but are possible at this time, we could make a difference, and a difference not just now in 2020, but a difference that would last into the next decades. So my hope is that in our discussion and in our own work, we will each be part of that change. Thank you so very much.
Thank you very much, Sabina. That was a fantastic overview of who is at risk globally. And we really especially appreciate that positive encouragement. And so to move to our next discussion, Dr. Patrick Vernon will take us through what we know and what we can do about Black, Asian, and minority ethnic. And here we are specifically focusing on the UK context. Dr. Patrick Vernon is a cultural historian and activist working across mental health, public health, heritage, and race equality. And he's currently Associate Director for Connected Communities at the Center for Aging, Better Equality, and Diversity. He is also an advisor to Lambeth Council, Chair of Citizen Partnerships for HSIB, and Senior Associate at OLMEC. Patrick, you have the microphone, please.
Hi, good evening, everyone. It's really great to be at this seminar to explore the issues around COVID-19. So this is a graphic illustration that was done by a good friend of mine, Dr. Pen Mandonka. She's a graphic facilitator, and she's based in the UK, but she's currently living in New Zealand because of the lockdown situation. So I worked with her, and we created this kind of graphic of the issues around health inequalities and its impact on Black, Asian, and minority ethnic communities in Britain. And this is the impact of COVID-19, which in many ways has further reinforced the health inequalities around socioeconomic conditions. And if you look at the previous presentation, which looked at the world view, the world global view, that world global view is actually a microcosm of what is happening in Britain today around COVID-19. If we look at public health policy since Second World War, all policy has always been based on social and economic classes. And also, but it wasn't until the last 20 years that we've actually had more focused public health policies. The very first public health strategy for Britain, believe it or not, wasn't done until 2003. That was called Programme for Action under the last Labour government. I was actually a civil servant at the time, and I was part of the civil service team that developed that strategy. And that strategy recognised that health inequalities, stuff around poor health, housing, the environment has an impact on your life expectancy and your morbidity, particularly around key issues around cancer, diabetes, etc. And since that time period, there have been numerous strategies, there have been numerous interventions, but always the weakest link has always been the issue around race equality. Race equality has always been a footnote or a paragraph, if you're lucky, even a page on some of these strategies for many years. And when we had COVID-19 and its impact, especially over the last 3 or 4 months, it has forced the issue around race and health inequalities. It was always very convenient for the government and for public health specialists to talk about racial disparities in the context of a subcategory of health inequalities. But with COVID-19, this has further exposed that race inequalities and health inequalities are now on the equal footing. And this is quite important because the impact of this has been quite clear. There have been numerous academic research studies, done rapid reviews, and also a number of government reports, particularly the Office for National Statistics. And that report highlighted that black men, particularly African Caribbean men, were 4 times more likely to die of COVID-19. And then people from Southeast Asian and Bangladeshi backgrounds were 2.5 times more likely to get COVID-19. And there've been more research work targeting the Southeast Asian community as well. If we look at the impact of COVID-19, well, particularly in our health service, the NHS, which is the biggest employer in Britain, employs 1.3 million people. And only just over the weekend, we have celebrated its 72nd anniversary of the creation of the health service. 90% of NHS staff, working frontline staff, whether they're clinicians, doctors, nurses, or auxiliary staff, or porters, nearly all of them who died of COVID-19 in hospitals were of Black and Asian background. This was started to emerge around about early March, and it wasn't taken that seriously at the time. But as each day there were media stories, profiles of individuals who had died on the front line, and at the same time, the campaign around the clap on a Thursday evening at 8 o'clock, clap for our heroes. People then raised concerns. What's happening? Why is it that more and more people from Black and ethnic minority backgrounds in the NHS are dying? We don't really know how many people have died in the community because unfortunately we don't record ethnicity on death certificates. But we didn't know how many people died in hospitals because all hospitals are keeping data, recording data, and that's been quite useful for a number of academics to do a number of analyses as well. And as a result of the increasing number of deaths and the emotional stories linked to the work of these frontline workers, we found out 3 things. We found out that some of them did have some health problems, underlying health problems, but also what we've also found out that a number of those staff members were reassigned to work in COVID wards without the necessary proper PPE. And thirdly, we also found out, which is nothing new because I've worked in the NHS myself, that systemic history of bullying and discrimination against BME staff has meant that the vast majority of staff who've died of COVID-19 are always at the lower ends of the hierarchy in the NHS. Very, very few white managers of the NHS, or nurses actually, have died compared to with COVID-19 compared to the vast majority of Black and North ethnic staff. When the NHS decided to roll out the emergency hospitals, and this is quite a common phenomenon, particularly in Europe and also in America, these emergency field hospitals, because the whole campaign around the government was to save the NHS by staying at home, not using the services unless you really needed to, because of a fear of overcapacity and stretch. These emergency hospitals were named after Florence Nightingale, who was a nurse in the Crimean War in Turkey in the 1850s. But also there was a Black nurse who also served in the Crimean War at the same time, called Mary Seacole. And a lot of people, I led the campaign, which I got a number of people to sign my petition, got a lot of media attention, to say if a lot of these BME staff who are dying of COVID-19, but yet the NHS has not even recognised their contribution, and it was important to have someone like Mary Seacole be named after one of these hospitals. Eventually she was named after one of the recovery hospitals, but that was a result of a lot of media pressure and a lot of internal campaigning within the NHS. And in many ways that highlighted the racial inequalities, disparity facing not just the staff, but also the wider community as well. One of the consequences of the COVID-19, there's been a lot of peddling of different theories to explain why has this occurred. And unfortunately, the eugenics arguments have crept into the debate during this period, which I think is quite important. And I'm not quite sure whether these debates will happen at a global, international level. But the arguments seem to be, because these are Black and minority ethnic communities, yes, of course we recognise health inequality and poverty, but maybe there's something innate in people of colour because they're dying of COVID-19 compared to white people. And it's quite important that we challenge these often eugenic racist assumptions, because this actually was starting to influence government policy. And I'll say the reason why it's starting to government policy, because when the British Medical Association and the Royal College of Nursing and the trade unions and community activists were raising the concerns, the government didn't take it seriously. They just simply assumed that all BAME people, you have health problems anyway, so therefore COVID-19, just live with it. But we were dying with it, and the more our voices got bigger and bigger, the government then launched, agreed to review the data, public health data around deaths as well. However, the report itself, which was conducted by Public Health England, was fraught with problems in terms of who was involved in the report, the terms of reference to the report. And when the report did come out, half the report was missing. And this is quite important, because when we talk about next steps and actions, and I'm sure we're going to have a debate about this, what was quite clear, the government deliberately suppressed key elements of the report with the fear, and this was around about the same time actually, when the murder of George Floyd in America and Black Lives Matter, the government had this assumption, a colonial assumption I have to say, that if we were to share this full data about the impact of COVID-19 and the issues of structural racism and its impact, then there'll be mayhem, blood in the streets and rioting. This is classic government thinking of how they see us, that we can't have a proper debate. And so they suppressed half the report, but luckily a number of journalists from BBC or Sky News were able to get the full report, which forced the government to disclose. And when we got the full report, it was no different to all the data that we know around tackling health inequalities and best practice around health messaging at all. And I'm part of a team where a campaigning group working with an organisation called Ubele, and we are taking the government to court. We are demanding a public independent inquiry, because what's quite clear, that one of the consequences of this pandemic in Britain, that the government has not given proper information, has given mixed messages about issues around social distancing and policies. And as a result of that, they have not even come up with an action plan after 3 months later around how they're going to save the lives of Black Asian communities in Britain. No steps, no action plans. The only thing that's happened is letters been sent to all NHS trust bodies to say that if you've got BAME staff who may have underlying conditions, don't stick them on the front line in the COVID ward. And that's about it. So we're demanding a public inquiry. We're working with the lawyers, Lee and Day, and we are taking judicial review, because we believe that the government has not been honest to communities, and they have reinforced the kind of stigma and discrimination facing BAME communities in Britain. Black Lives Matter also happened at the same time, and there's been a national debate in Britain regarding what is history, what is memorial, and more importantly, a debate on race equality. And this has further heightened the need to tackle the pandemic and to have policies which reflect the needs of the community. I could carry on quite easily, but I will stop there.
Thank you very much, Patrick. That is a really good presentation, and we really appreciate your work. And so now we move on to welcoming questions, both on Sabina's presentation and Patrick's presentation. If you'd like to ask a question, please raise your hand. You can find that at the bottom of participants tab on your screen. We will be going in order of whoever has raised their hand. So if you have a question, please raise your hand now. Yeah, I just probably will begin with my own question as they sort out to each of the speakers. Sabina, I'm just interested to know in the way you've been looking at how COVID has been affecting different communities around the world. What are some of the local initiatives have you seen that have strengthened that solidarity that you're talking about? Maybe one country and one example, especially countries like India that has so many numbers, or others. Yeah, thank you. And then I'll ask Patrick after.
Yes, no, thank you so much. So our research group works mainly with governments, and we are the secretariat of a South 60 country network of governments and international agencies. And so when COVID struck, what we found was that the same people who we know, because they're working on poverty, now they've pivoted and they're working on COVID. And so a couple examples. For example, in Pakistan, which is a large country, very populous country, there was the COVID lockdown, and so employment was lost, and there was a big need to target people who were the new poor. And so what they did, and they've done this also across Latin America, is they take the list of people who are already receiving some kind of benefit, and then they increment it, they increase it, so that they receive more. But there what they did was they asked people to SMS if they were in hardship. And then they looked and they had to SMS their national insurance number, their ID number. And then they checked to see, you know, had they been out a couple times, did they own a car, did they pay income tax on a high salary, just to rule out people who maybe weren't actually in need. And then they were able to address the new poor. But what that took at the local level was an incredible amount of organization, because people had to be able to go to banks. They had to be able then to go and spend the money, and all of this with social distancing, and all of this very quickly. And so the kind of coordination between, you know, one place in a capital city that makes something available, and then all of the different local actors trying to, you know, register new cards, register deaths quickly enough because the offices were closed, so that the family members could receive the benefits, and all of these different things. It requires many different people to be very alert, wanting to do the best for their communities, and calling upstairs as well as waiting for directions to come down. So we've seen a number of that. I could give many other examples. And the other activities, of course, is when there are very remote populations, then they might not be connected. They might not know about it. And so they would be very much at risk if somebody who is a migrant worker comes back to them. And so then there's needed to be lots of activity and discussions between these rural areas and an appropriate quarantine or an appropriate information for them. Because otherwise the fear is that, you know, they would come and they're not near to health facilities. And so a lot of the activists, the community activists, have become very active and said, no, our returning migrant workers have to quarantine, or you have to send messages and so that we can actually have your support in terms of communicating the situation to our communities. So those are just two examples of so many.
Thank you very much, Sabina. That's a very good example. Perhaps before I ask my own question to Patrick, I'm just going to ask Mariam, who has raised her hand. I think I can see it. Mariam, would you please go ahead and ask your question?
Hello, I have a question for Dr. Vernon. So I was, first of all, thank you so much for sharing your presentation. I found that to be really impactful. And I guess what I was wondering is I was really struck by the similarities between the way in which racial inequality in the United States has become apparent because of COVID-19, and how that parallels what's happening in Britain from everything that you've just told us. And so I guess what I was wondering is if you see any differences between between like the responses that Britain has had to this and the responses that the US has had. Because it seems like they're pretty similar, and I know that your focus is on racial inequality in Britain. But I was just curious if you've noticed any differences between the two countries.
Sure.
Thank you, Mariam. Patrick, I have a second question for you, if you don't mind, that I'm going to read. The second question is also addressed to Patrick. It is in the chat box and coming from Adilson. And it says, is it possible, dear Patrick, is it possible to say that British government position on this issue derives from an interest in denying the relevance of racial disparities in this particular situation, or it reflects, I guess, colorblind discourse that characterizes official position on this question in Latin American countries as well? Patrick, do you want to take those two questions?
Yes, so thanks for those questions. In terms of the first question, there are a lot of similarities between the USA and Britain, particularly if you look at the experiences of the African American community and the Hispanic community and the Black British community, which includes African Caribbean as well. I think in America, the death rates and the number of African Americans who have died, it's just been unbelievable, completely off the scale, especially in places like in New York, like New Orleans, etc. And with the level of deaths have happened also in Britain. The problem is actually a lot of the day we don't know how the true number of deaths of Black people in the community, because a lot of people weren't tested for COVID, and this is a lot of similarity with American experience. The rollout of COVID testing has been really poor. There's been hardly any sufficient resources been put into that at all. So that's one similarity. There is similarity in leadership. Boris Johnson and with Donald Trump, they've adopted, which can lead on to the second question. They don't believe there's structural racism. They believe they're doing a good job, and they're not even for the whole populations of America and Britain. They've not even given the confidence. A lot of people have decided at a local level to make their own decisions around how they've interpreted social distancing policy. And when you have government advisors flouting the policy which the government have told us to follow, then people will make their own interpretation of that. And I think the key thing is that both governments don't recognise the inequalities of discrimination and its impact of COVID-19 on that communities. When Matt Hancock, the Secretary of State for Health, in the early days of the pandemic, said that we're all in this together, and when there was more and more data highlighting that actually we're not all in this together, the government did have a colourblind approach. They were only forced into doing this review on the deaths of BAME communities in Britain because of public pressure, and that's going to be important for the next steps forward. And what has happened is, this has highlighted the inequality. There has been fantastic public support from the public in Britain, recognising these inequalities. So, for example, I've launched a fund called the Majonzi Fund, Swahili, for those who know, means deep and grief sorrow, because the public recognises the death. That each day is a story of someone from African community, Caribbean community, and particular Filipinos. A lot of Filipinos in Britain have died. Frontline staff have died of COVID-19, and the public have been supporting, making donations, giving solace, and the government has only come to this more recently. They've been dragged into acknowledging the deaths, and it raises deeper question about respect and humanity as well.
Thank you very much, Patrick, for that. The second question, the third question comes from Hugo. Hugo, you want to go ahead, please, and ask your question.
David, thank you. And Sabina and Patrick, thank you both very much indeed for these important talks. Sabina, I just had one question for you and then one for Patrick as well. Sabina, I really hope and that you're right and that Amartya Sen's right, and we can get some real positive new policies that are much more about equality out of COVID. But my question is, how much does that need money? And how much government money is there around? Are we looking at an aid squeeze, or can we go on printing money when governments are also giving extraordinary levels in aid giving countries as well. So how much do we need money, and how much is there for what you think we should achieve? And then Patrick, just on your points, and thanks very much for explaining the British situation to a largely American crowd. I think that's really valuable. And do you have sort of one or two big asks to government? I know you're suing them about the report at the moment, which seems, you know, totally right and fair. Do you have one or two big things to ask to address structural racism so that COVID leaves a positive legacy as well?
Mm-hmm.
Sabina, you want to go first, please? Then Patrick. Mm. Sabina, you can unmute.
Thank you so much, Hugo. The fact is that many of the governments around the world are already designing economic stimulus packages. And they are trying to model this on the responses during the Great Depression in the 1930s or beyond, because it is different than the 2008 recession. And so one question is, given that there will already be excess spending, can those investments, which are basically often a large component of job creation, not be investments in building airports for the rich, not be investments in building, you know, sky windows in rich people's houses, but can they be investments in building the social structure that the country needs in order to have a more equitable baseline of well-being for the population? And so I think that that is one clear thing. It needs money, but money is going to be spent in most economies in order to stimulate a rebound. The second is that international aid can be supportive. And I mentioned that on the 16th of July, we will launch the Global Multidimensional Poverty Index 2020 with the Human Development Report of UNDP. And what we find in that is that of 75 countries and 5 billion people, the country that had the very fastest reduction of multidimensional poverty was Sierra Leone. And it was Sierra Leone between the years of 2013 and 2017. And those were the years when the Ebola epidemic raged in Sierra Leone. Now, it's not that every response was perfect. There was lots of human error, and maybe, you know, there's a lot to learn that maybe didn't go perfectly. And yet, even with the imperfections, even with the mistakes that we make, even with things not being as fast and as perfect as we would want, there was a massive reduction for poverty. And it was driven not by an indicator, but by 5. And so I think that, in a sense, you may overestimate the bar. The bar is low to reduce poverty. It is possible to really make big inroads with a little bit of effort. And so I think that that should be possible with international aid. And the third point is the bottom up. You know, that some of these may not require external support and external action, but it might that communities and indeed unemployed people can themselves take leadership, take voice, and act in new ways. And again, trying to encourage that unleashing of imagination and creativity, whether it's young unemployed people or older people or people early retired, and try to encourage them to invest put their shoulder against the wheel of social change. And hopefully that could also contribute. But I think fiscal resources where they are offered are a part of the response.
Thank you very much, Sabina. And Patrick, please go ahead.
Sure. Since World War II, there's been, when people were invited from the Caribbean, from Africa, and Southeast Asia to help rebuild Britain after the Second World War, we have contributed to Britain economically, politically, socially, working in key jobs and key roles. And the people use the concept, maybe for the American audience, maybe called the Witness Generation, who were invited as part of that journey. With the pandemic, it's highlighted the inequalities that have existed for many decades in Britain. And with Black Lives Matter, that's further intensified that. And also in Britain, we also had what was known as the Windrush scandal, which was really about Black British people who were stripped of their rights as being British citizens under immigration policy. All these things have exposed Britain today. And what needs to happen, and now we have a national debate in Britain about race inequalities, discrimination, and its impact on intersectionality. I hope that this is an opportunity for the government to seriously consider its position and to work with a whole range of stakeholders, academics, policymakers, campaigners for a better Britain. Because if the government does not acknowledge these problems properly and to work with stakeholders, then these problems will further exacerbate. And because this event is in the context of human rights, it means that our human rights are being abused and not being held and not being respected. So we've got a long way to go. We may not have we have a long history of campaign in Britain and fighting for our rights from the time of Equiano, Lord Equiano, who was a Black abolitionist in London in the 18th century, never recognised for the work that he did fighting for our rights. So we have a long history here in Britain, and that history of journey of civil rights sadly will still have to continue.
Thank you very much, Patrick, for that response. We want to thank everybody who asked questions for this part one. And I also want to thank Sabina and Patrick for taking your time and leading us to this part one of this webinar. We really appreciate the insights that you have given us. We invite you to stay as we cross over to the second part of this webinar. And to start us off, discuss comparing policy responses to inequality using a tracking index is Tamara. And Tamara is a PhD student at University of Oregon, originally from Argentina. And she is a webinar series at Oxford Consortium for Human Rights. Tamara, welcome.
Hi, David. Thank you so much. Let me share my screen really quick. And one more thing. There we go. So yeah, I'm going to walk you all through a brief world overview comparing policy responses to some of the inequalities that have been mentioned by the previous speakers. And to start, I want to put us all in place with where we are at with the pandemic in the world. This graph is showing the number of daily deaths in different countries. Here we're seeing that there's a surge in Latin America, which means global daily death toll is rising again in the world. Then countries like in Europe or in the UK have been actually able to control and contain the virus, and they're going through this phase that in my talk in the previous webinar, I called the dance. So they're dancing with the virus and they're reopening and trying to contain it, and they're doing it fairly successfully. Then the US is the top one country with number of cases, and is surpassing the European Union average number of cases in almost every state. And another country that is going through a very high number of cases is Brazil. So what are countries doing to control the virus? And as we know from the success in some countries, really strict lockdowns have been some of the most successful measures. So here we're looking at the different levels of how strict the measures that the different countries are taking are. So we can see some countries in South America are still in a strict lockdown. Some countries that are reopening don't have that much strict measures. And there are some countries like the US or Brazil who probably didn't take as much strict measures at a point. So now they're probably facing new challenges on whether to maintain reopening or to make more strict measures. But what does it mean to have a strict lockdown? It means that it also brings some impact in society, and one of them is an economic impact. And we've heard a bit about this from Sabina. This is an estimation. We're not sure if this is what will happen, but what estimations are telling us is that the number of poor people in the world is going to increase. And one of the worrying things is that a large share of these new extreme poor estimates will be concentrated in countries that are already struggling with high poverty rates. And also even countries that are in lower or upper middle income are also going to suffer an increase in a relevant increase in poverty. So what are countries doing to help the poor? What kind of measures are being taken as of now? So here we can look at the different types of measures in different areas of the world. And two of the main measures are cash-based. That means they're giving directly money. And the other ones are in-kind based or other types of assistance, for example, giving a ratio of food or something similar to people. But 50% of the measures are cash-based. So I'm gonna talk about two specific examples to see how this is working. And then I'm gonna move on to other inequalities and see whether governments are responding to that. So yesterday I read an article comparing the measures that the US have been taken in the US and in Europe to help the poor, and specifically to either avoid joblessness or how to manage unemployment. So basically, the US and Europe in general terms have taken different approaches. The US seems to have relied in expanding unemployment benefits to sort of cushion the blow of millions of people who are unemployed, while European countries have been nationalizing payrolls or subsidizing wages or enabling paychecks to continue uninterrupted to just avoid the surge of joblessness. And still a question which of these two will work better in the long term. But one thing that we've seen is that the European approach has spared people from going through the anxiety and the stress of waiting for the relief and going through bureaucracy hassles. And even though the US has had other programs similar to the Europeans, they have some more barriers that doesn't allow that much approach. So maybe they're still, and since all of these measures are temporary and they're actually about to expire, it's a big question mark what's going to happen now, where, for example, in the US cases are going up and there is no national health care system. So most people depend on healthcare through their jobs, and if they're unemployed, that will be a big challenge. The other example I wanted to give is Brazil, because it's the other country that's going through a big increase in cases. And Brazil is going through three crises at the same time: a health crisis due to the pandemic, a political crisis where even their democracy is being challenged, and an economic crisis. So one measure that Brazil has taken to help the poor is called the Auxílio Emergencial, where they're trying to cover those people who are experiencing a reduction in income through a paycheck, a monthly paycheck. But again, this is temporal and it's not reaching everyone who needs this help, because another big challenge in these cases in Brazil and in other countries is that presence of informal workers. 61% of the world's workers are informal, and 90% of them are in developing countries. And they are left out from basic labor and social protections like the ones I've mentioned before. However, the World Bank has been keeping record, and there are many countries that are trying to implement new measures to try to help these cases in particular. So, for example, in South Africa, they've received a grant that they are hoping to pay for 6 months some cash to individuals who fall outside from the unemployment benefits, for example. In Brazil, in some places, they are delivering food to children in public schools. And something similar is happening in India with delivering food rations. Of course, these are not perfect, but these are some ways to try to reach further people. And when we're talking about inequalities and the impacts from the pandemic and the lockdowns, another big inequality has to do with access to education. Less than 25% of low-income countries currently provide some kind of remote learning, and most of it is through TV and radio. While on the other side, 90% of high-income countries are providing remote learning opportunities, and most of them are online, with also providing assistance to teachers and students going through that process. And one last inequality that I wanted to mention, and I think will be key to cue us up to our next speaker, is racial inequality. And now I'm gonna put a lens in the US in particular. The last few weeks, there have been a lot of reports showing that Black and Latino people have been disproportionately affected by the coronavirus. And this has been across the country, throughout urban or rural areas, and across all age groups. And this has also had an impact in the economy also, because now that the country started reopening and people are getting jobs again, there's still differences in different ethnic or racial groups. And in particular, Black men haven't seen an improvement in their chances of obtaining a job or being employed. So no wonder that under this context, and after certain events like the death of George Floyd, big social movement has come up, which is the Black Lives Matter movement. And I'm going to end here to let our next speaker go on. Thank you very much.
Tamara, thank you very much for that overview. When we began this webinar, I promised you that we would have a global overview of what is happening on this inequality, which Sabina delivered very well. And then we moved to the context of the UK, again, which Patrick led us. Patrick led us in that discussion. And then we had a question and answer. Tamara has just given us some numbers to look at and statistics. And now we have Dr. Diva Woodley, who is an associate professor of politics, director of undergraduate studies at Department of Faculty Advisor for Politics, the New York School of Social Research in New York. And Dr. Woodley has spent time writing about Black Lives Matter or this kind of movements. For example, her book, The Politics of Common Sense, How Social Movements Use Public Discourse to Change Politics and Win Acceptance, published by Oxford University Press in 2015, has been used in many discussions to discuss the current movement that we see. And she has a forthcoming co-edited volume on Black feminist visions and the politics of healing in the movement of Black lives in women's mobilizing memory. And we are really grateful that Diva, you could join us and give us insights on what is happening in the United States. Diva, you have the floor. Please go ahead.
Okay, thank you so much, David, and thank you to all the presenters for presenting such good and current data on the inequality and global impacts of this health crisis. So what I wanted to talk about a little bit is the way that the movement for Black Lives, or the Black Lives Matter movement, has been taking on or has been analyzing the current crisis. So the things that I really want to talk about are the ways that the Black Lives Matter movement is not only a movement about police violence, but is very much a movement about what it means to transform society into a place where Black people can live and thrive. And the Black Lives Matter movement, as you all know, is a global movement, although it began in the United States. And so the COVID pandemic piece although it came as a surprise to all of us, was already sort of part and parcel of what the Movement for Black Lives is talking about when it's talking about the ways that white supremacy, patriarchy, and capitalism prevent Black people and all people from being able to live lives where they can thrive. The first thing I guess I want to say is that the movement itself is not only about police violence, although that is what often sparks uprisings, and certainly the murder of George Floyd on camera, where a white police officer put his knee on George Floyd's neck for 8 minutes and 46 seconds and just suffocated him to death very casually and nonchalantly, has given rise to what is now the largest social movement in US history, with between 8 and 12% of Americans saying they have participated in a protest in the last month. That's bigger than any protest movement we've ever had, and has had a longer duration of mobilizations, mass mobilizations, and a wider breadth of mobilizations than any we've ever had. But this is a cumulative moment. It's not something that has just happened because of the murder of George Floyd. It has been a movement specifically building since 2013. And of course, it is a movement in response of the deep systemic racism that is constitutive of the United States since before its inception, during the Atlantic slave trade. Okay. But how does COVID hit this? Well, just a moment ago, Tamara showed us some statistics about the ways that COVID has hit different US populations differently. And that Black people and Latino people and Native American people, all the people who show generally systemic impacts from discrimination and inequality most, have also been people most likely to contract the coronavirus, the novel coronavirus, and to die. And just as Patrick said, at first, when this data was sort of being put out in an anecdotal fashion or piecemeal state by state, the sort of explanation for these differences in contraction and death were an almost kind of blame the victim trope that is racist in and of itself, which is that, well, these people tend to have higher rates of obesity and diabetes and other comorbidities, so of course they're dying more. Of course, those underlying conditions, right, of diabetes, obesity, et cetera, are also the result of structural racism because of, in terms of access to healthy food, in terms of, the stress of racism itself, which causes a condition called, or a phenomena that Arlene Geronimos has called weathering, which is to say that the stress of racism and systemic racism actually ages people in minority groups, Black and minority groups, at the cellular level, and makes them more likely to evince early onset of diseases like hypertension and diabetes, et cetera. But besides even the fact that those underlying conditions can also be attributable to structural racism, there are also more immediate structural conditions that cause Black, Latino, and Native people in America to contract this virus at higher rates. And those are about the professions that Black people tend to work in, which tend to be what are called here frontline jobs. And these frontline jobs are basically lower wage service jobs and construction jobs that can't be done remotely from home. So one of the major reasons that Black and brown people are contracting this virus at much higher rates is because they have not been able to observe the lockdown that whiter and more middle-class people are able to do. They're not able to work from home. So going out in the world, of course, exposes people to the disease in greater amounts. Now, that combined with underlying conditions is a large part of the reason that we see the differences in contraction. Now, in terms of treatment, we've had long-term and large-scale differences in access and quality of care in the United States to healthcare that has always split along racial lines, and seems that split, that divergence, actually seems to be increasing. And one of the main reasons that we saw this before the COVID moment was actually in maternal and infant mortality rates in the United States, which have been going up, unlike the rest of the sort of peer countries or rich countries. Maternal mortality rates have been going up in the United States, and that's almost entirely driven by mortality increases among Black and Native women in particular, and then Latino women as well, although at a lower rate. Okay, so before this sort of moment of uprising, the Movement for Black Lives and other organizations that have been in the Black Lives Matter fight since 2013, when Trayvon Martin was murdered, and 2014, when Michael Brown was murdered, had been already establishing mutual aid networks and had released online a plan to try to combat COVID in Black and Brown, minority, and poor communities, that was about trying to make sure that people had access to the protective equipment, right, that we needed, right? At first in the United States, there was a shortage of masks, and you could not get masks for most of the month of March as a sort of regular person. And this was exacerbated, of course, in communities of color. And so just doing things like that, and then sort of access to food, what happens to access to food in what we call food deserts, right? Which are not actual deserts as they might be in other parts of the world, but actually places where you don't have grocery stores, and instead you have corner stores that have no nutritious fresh foods, and only have sort of pre-packaged, high sodium, high sugar things to eat, and usually at higher prices than in nearby higher class and more white neighborhoods. So the movement had been thinking about the differential impacts that coronavirus, the novel coronavirus, was going to have in Black and Brown communities even before the murder of George Floyd sparked massive in-person uprisings all over the country. Since that time, the movement has taken the opportunity to use this moment to more clearly make the case for what we need, which is vast systemic transformation away from an economy, a political economy, and political system that privileges the viewpoints and resources of upper class white people, and especially upper class white men, to the detriment of all other segments of the population. And that kind of transformation has to do with the way that we spend our resources. Sabina has talked about this in a more sort of global context, but the notion that bottom-up, self-determined, right, or community-determined, dispersal of resources is really the key to a lot of the problems with inequality that we face, is one that is very key to the movement itself, who has called, since they published their original policy platform in 2016, that this has to be about investment in Black and Brown and poor communities, and divestment from institutions that don't serve us. This brings us to what might seem like an unrelated demand, but is not, of what has risen in the United States, of the defund the police demand from the movement. this demand is about actually the redistribution of resources, because in the American case, as other presenters have already said, and as you may know, there is no national healthcare system. Our healthcare is private. You must pay for it out of your own pocket, either through insurance, or through private policies. Those insurance policies are carried by our employers. Some people have been able to get coverage through what is called Obamacare, which are private health exchanges that are coordinated by state governments, and some through Medicare expansion, which is our only Medicare and Medicaid, which are our only public health apparatus, and they only affect certain parts of the population, not the whole population. So healthcare is already very unequally distributed in the United States, and it's not publicly funded at all. The thing that is most publicly funded, right, is not healthcare, is not housing, is not education, but is actually police. In most municipalities in the United States, that is in most cities, towns, and states, police budgets account for between 30 and 50% of discretionary spending, public spending by the state. Okay, let me say that again. In most municipalities in the United States, between 30 and 50% of the discretionary spending of public tax dollars goes to policing. Okay, and so the defund the police demand is really about being able to put those resources in places that actually cause people to be healthier, right? And we know that what actually causes people to be healthier is having access to healthcare, having access to housing, having access to education. These are the things that actually make people safer and healthier. And so it's of a piece. I guess I just want to close by saying that it is unwise to sort of underestimate the scope of change that would be necessary in order to create a world where we could significantly mitigate or eliminate the effects of inequality. Because much of the inequality in the United States case, and I'm sure others would say in the global case, is built into structures that are meant to preserve white supremacy and meant to preserve the capitalism and the rich, or people who already have resources, maintaining those resources. And so, the movement for Black Lives is asking for deep structural changes that are connected certainly to police and state violence, but go much, much broader than that, and are really about how is it that we can create a world, build a world from the bottom up, where the most marginalized people can live and thrive, and what kinds of sacrifices are other people who say that they believe in equality willing to shoulder in order to build that kind of world? Thank you.
Thank you very much, Diva. Now, for that wonderful presentation, we have two questions already, which we have first. Brandon, you have your hand up. You'll go first. Hello, can you hear me? Maybe you raise your volume a bit.
Can you hear me now?
That's good. Go ahead.
Okay. So my question is for Diva. I wanted to know if there's any strategy. I completely agree that the focus on kind of the economics of the issue really ignores the systemic part of the issue. And I just feel like when people focus on the economics, they're muddying the water of what's really happening. Do we have any strategies to refocus on the systemic inequalities when people just try to say, oh, this is an economics thing, we need to make sure unemployed people get their money, and then otherwise there's no more problems?
You gotta go ahead and answer that, because next one is not for you.
Sure. Yes. Well, I think that it's a mistake to separate economics from systemic inequality. Systemic inequality is economic inequality. It's racialized economic inequality, actually. You know, it's something that we can talk about as Cedric Robinson did, as racial capitalism. So it is true that we do need to make sure that unemployed people get their money, and the United States has done a very poor job of that in terms of its relief packages. And we heard a little bit earlier about the different strategies that Europe and the United States have taken in terms of relief for people during the COVID crisis. But it's also the case that in the United States, unemployment is stratified by race, so that currently the US unemployment rate is around 11%, but if it's broken down by race, it's 15.4% for Black people, 14.5% for Latinos, and 13.8% by Asians. So when we talk about economics, which we certainly should do, we should also recognize that economics is always racialized. It's never race neutral. The poor are never just the poor, right? We see systematic differences between the poor depending on how they are racialized in the particular national context that they're in. And so we need to attend to those things and not pretend that these differences don't exist and that our responses shouldn't be tailored by race and ethnicity, given what we know about how empirical impacts play out depending on how one is differently positioned in social structures.
Thank you very much, Diva, for that and for the question from Vernon. The second question, I think, is actually best addressed by our earlier panelist, Sabina. In the second question comes from Maya, who says, in the momentum of responding to COVID-19, amongst other political and socioeconomic challenges, is there a favored or recommended approach or strategy to guarantee sustainable and equal access to resources, especially to the disenfranchised and in areas affected by armed conflict? Sabina, are you able to answer that kindly?
Yes, that's a splendid question and such an important one. And I think that the answer is very much yes, but it has to be very intentional. So I work on numbers, I work on numbers, and we disaggregate them by many different groups. And one of the things we're able to show exactly what Diva was talking about, these vast inequalities, whether it's between ethnic groups, and as I said, we're about to release on as many countries as we can disaggregate by ethnic groups or along other lines. And let me tell you a story, because it's maybe more interesting than a lot of numbers. In the country of Colombia and South America, when President Santos was trying to work towards a peace agreement, there was multidimensional poverty among the people in FARC-affected areas, and the people, and they found that poverty was vastly higher in areas of conflict. And so that actually came into the peace negotiations, that part of the peace, the Havana Accord that ended the long-term civil war in Colombia, was a commitment to reduce poverty within 2 years in a number of named communities. Similarly, part of the peace accord was to attend to the victims of violence, people who had very sadly lost somebody in their family. But it was also to integrate the ex-convicts, who were coming back, who were scarred by having fought, who were unemployed. And so there was basically a very articulate recognition that we have different people in our society that not only have the effect and the personal tragedies, but they also have the socioeconomic problems. And so making that visible, doing what we do, which is measuring it, and then trying to have very clear policies to reduce those inequalities, was one of the strategies for peace building. And I think that's what we've tried to do. When Mexico first launched its National Multidimensional Poverty Index in 2009, it was the first time the government had ever released data on poverty. And the night before the release, everyone what would the press think, because it was so much higher. You know, 43% of Mexicans were poor. It was over 70% of the indigenous community. And actually, it was just such a relief. It was a relief to have numbers out, have facts. Somehow it makes it more tractable because you have to do something about it, but you also can, and you can see if it's worked by updating. And so that's a part of the story. I think that very much there's a need to recognize the differently affected communities. And now in communities under that motion, communities with hyperinflation. People are giving cash transfers, and hyperinflation means it doesn't buy the food they need. So there are different kinds of vulnerabilities that we always have to be on the lookout for, and then try to nail in a tractable way.
Thank you very much, Sabina, and especially for using that story. I will take the next three questions all together. First, Hina, and then Wayne, and then David King. Hina, please go ahead.
Yeah, hi. My question is for Deva. I was actually wondering if you can talk about how we can ensure that funding that is slashed from police budgets is then thoughtfully implemented into community building programs. I'm worried about keeping our leaders accountable when a lot of times the people who are, protesting, the people who are on the front lines aren't on the decision boards for funding.
Thank you, Hina. Ask David King if he's ready to go.
Yeah, I'm ready.
Please go ahead, David.
Yeah, I'm. My question's for Deva, but for the other panelists as well.
Sorry, I'm back.
Given the economic inequalities in the States and maybe across the globe are a result of slavery and the legacy of slavery, I'm just trying to think where the reparations movement comes into this. That's it might be a case. Because it's in the States, I understand that the reparations movement is well established, done all the research, have a plan worked out, whether it's time, in the words of one of your speakers, to put our shoulders to the wheel of the reparations movement as one way of dealing with this.
Thank you very much, David King, for that question. Now, Wayne is back. Winston, please go ahead and ask your question.
Okay, can you hear me okay?
I can hear you just fine.
Outstanding. I'll try to make a long question a little bit shorter. I'm a activist in Connecticut. I work with Reverend Jackson's Rainbow Push. I'm a political consultant as well. And excuse me. So I've worked on getting our senators elected, the current one, Blumenthal, Chris Murphy, and so on. And I'm a very strong advocate of Black Lives Matter. And what I'm seeing in the concern is what happened with the Million Man March. That was supposed to go terrible. It was supposed to be fights and so on, and all these different denominations, nationalities, backgrounds, religious and otherwise, went to Washington, made a statement, but they basically went home, and they did not have a plan for them when they came home. So it basically kind of died on the vine. I know that George Floyd has been a major, had major impact. In my community, we're working on tools that will change the police departments on an individual basis, because there's state legislation, then there's local legislations. State legislation you can use through your local police departments to have them deal with things such as the police report, which is the major problem where it starts. So if you write something in that police report as an officer, it's the finger of God in court. So we're taking it from that end as well. So I want to give you that short overview to say, I hope that Black Lives Matters can figure how to get those types of things on the table, because there's still a lot of marches, but the discussions about the exact solutions, city by city, is based upon the talent that is in that city. And some are doing it better than others, which is to be expected. And I'm not saying that they need to elect the leader, because that's part of what the problem is. You can't elect the leader when you got so many people as grassroots and everything, which is also its power. So I'm curious what you think about that, because for me as a activist, as an organizer, the tools become, this is the thing that will change it in your police department. Because for me, the most important thing we could do is make sure that no more Black people are being killed by the police department, which was the catalyst. And the watershed is, you know, we are racial equality when it even comes to pay. We get paid the same. The disparities in healthcare, all of those things can be done. But if we don't get legislation out of this thing while we have ears to hear, I think we would have failed a lot. And sometimes they just need to know where to start. So that's my question and my statement. So let me just shut up right now. But I appreciate you guys. Go ahead.
Thank you, Wayne. Thank you very much for that comment and a question. I would now let Deva talk about answer Hina's question on the police budget being slashed, and come to David's question, Wayne, as well. Deva, please go ahead.
Okay, thank you for the questions. Okay, in terms of their concern about accountability, that is a huge, very, very legitimate concern, right? So even when policies are adopted by municipalities or states, for example, we see varying levels of enforcement depending on accountability, the accountability measures that are in place and what people expect in terms of public attention to the issues. I think that, which is something that I also showed in my first book, The Politics of Common Sense, which in that case, living wage legislation in the United States, we have a minimum wage that is very far below poverty line. No one in the United States, anywhere in the United States, could live on what is the legal minimum, the legal federal minimum wage. And so since the 1990s and through the 2000s, there's been a movement to increase federal and state wages to a livable level, right? That movement was hugely successful in getting municipal policies adopted throughout the United States during the 1990s and 2000s. However, they were not successful at getting enforcement or at preventing people at sort of a higher level. So if the living wage ordinance was adopted at a city level, the state would often overturn the ordinance, and so it would never be implemented. So accountability is a huge issue. This is why it's so important that there's been a transformation of public opinion on this issue, not only in terms of how many people support the movement for Black Lives, which in the American case is an astounding amount. The movement has close to 70% approval rate, in public polling, and almost nothing has a 70% approval rating. Certainly our elected officials very rarely do, and neither of the two presidential candidates do at this time. So the movement has been very, very good at sort of getting its message out. And again, I want to remind people that this is not about George Floyd in this instant, right? The movement did not arise in the last couple of months. Right now is a culmination of what the movement has been building for the last 6 years. So it's been a very slow burn of public education on these issues, in addition to the relentless reproduction of the same circumstances, right? We keep getting these traumatic videos of Black people being hunted and killed by vigilantes in the state. And it's just something that hasn't been able to be explained by the old colorblind framings or law and order framings that were dominant in American discourse. So the movement's framing, that is Black Lives Matter framing of institutional white supremacy, has taken on currency because it actually helps us to explain the reality that we keep seeing on repeat and have done for the last 6 years. So this is a long answer to the question, but the point is the accountability is there in the public gaze and the way that people value the issue of racial inequality when they vote, right? And it seems that people are beginning to value that issue, more and more, not only as something they agree with, but as one of the top issues in the country. So one of the things that helps with accountability is the attention of the public and their expectations. That really helps activists and organizers when they raise non-compliance with accountability. to the public at large, then they have the sort of support of the public to sort of force officials to do their job. So that's one thing. The other side of it is actually having people who believe in the cause and levers of power. And the movement for Black Lives is hugely underestimated. This is not the Million Man March, right? This is not any kind of one-day thing. There's an enormous infrastructure that's decentralized, but it's behind the movement and helps to coordinate activities in different cities. And one of those activities is the Electoral Justice Project, which is all about getting people to run for offices, both local offices in their municipalities and state offices and federal offices, right? Having people, a deep bench of leadership that assumes decision-making power, so that that's another kind of lever of accountability. This started to happen at the very beginning of the movement when one of the main political tactics besides protest in the streets, which is really just the tip of the iceberg of what the movement does. One of the sort of key political tactics of the movement was to vote out district attorneys, right? District attorneys in the United States are the people who decide what charges to bring in criminal complaints and whether or not to pursue charges against police officers. So one of their major tactics was to start voting out district attorneys who had terrible records on both of these two things. So that is the kind of thing that's been going on for years on end and is not going to stop now. In terms of the question about reparations, yes, 100%. Reparations should definitely be on the table and should definitely be thought of as, not an apology, right, but instead a reform of structural inequality and deep discrimination that has been built into our systems, certainly in the US case, but globally, right, around the world. In the US case, we have a system that very much like colonial systems is built to extract wealth from Black and brown people, mostly Latino and Native American people, and to have that then wealth be hoarded by the state or redistributed to white populations, particularly white upper class populations. This is most apparent in the housing market and discrimination in the US. In the US, most people's wealth is tied to their homes and home ownerships, and housing programs have been deeply discriminatory based on public policy in the United States and a phenomenon called redlining, which you may know about or want to learn more about. So it's all kind of tied up. Reparations should definitely be on the table because it's what it means to have just public policy, right? And without it, we actually probably cannot have just public policy. And then the last question really quickly, again, this movement isn't going anywhere. The people who are involved in organizing it, in different localities, it's highly decentralized. And as you said, that's one of its strengths. That's not a weakness. They're highly decentralized, but very networked, meaning that they're talking to each other all over. And people really hold to the view that you get in where you fit in, which means that you bring your talents in the places where you can and don't sort of try to do other things. So we have people who are working in the legal framework in terms of sort of cases, people who are working in education, right? People who are working to elect Black and brown leaders to offices, people who are writing policy platforms, right? It's a hugely dispersed and influential network that has already had an enormous impact on changing public understanding of what structural racism is and changing people's priorities in terms of what are the top political problems in the United States. So I don't think that it has any chance of fading away. Now, I agree with you that this is a moment to get the most concessions that we're gonna get, right? Right now. But it's also the case that there's a deep bench of power that is kind of being built through, public education, legal, and electoral parts of this movement as well. So there may be some long-term payoffs.
Thank you very much, David, for that. I want to thank all our speakers today as we come to the end of this webinar. I thank Sabina, Patrick, Tamara, and Deva for fantastic discussions this evening, afternoon or morning for some. I thank all participants for joining us from around the world. Special thanks to Alex, Tamara, Hugo, and colleagues at Oxford Consortium for Human Rights who are part of planning this webinar. We look forward to welcoming you to our third webinar, which should be held early September. And hopefully when distancing ends and the skies are open again, see you in Oxford face-to-face. My name is David Mwambari, and it was a pleasure hosting you on this webinar. I wish you safety and peace wherever you are.